Hello everyone and welcome back. My name is Dr. Ben Osevwe and today we are going to talk about substance use disorder, also called SUD. This lesson is for PMHNPs, PMHNP students, families, caregivers, and anyone who wants to understand substance use disorder in a simple and practical way. By the end of this video, you should be able to explain substance use disorder. We will talk about what it means, what happens in the brain, causes, treatment, and nutritional support. Short disclaimer. This video is for education only. It is not medical advice, diagnosis, or treatment. Substance use disorder can be serious and sometimes life-threatening. If you or someone you know is in immediate danger, call emergency services. In the US, you can call or text 988 for the Suicide and Crisis Lifeline. Part 1. What is substance use disorder? Substance use disorder is a health condition where a person continues using substances even when it causes problems. Substance use disorder happens when the brain starts treating a substance like it is more important than health, relationships, safety, school, or work. Substances may include alcohol, opioids such as heroin or fentanyl, cannabis, and stimulants like cocaine or methamphetamine. Also, sedatives like benzodiazepines, nicotine, hallucinogens, inhalants, and other misused prescription or street drugs. The National Institute on Drug Abuse explains that addiction is a chronic disorder involving changes in brain circuits related to reward, stress, and self-control. So substance use disorder is not simply a lack of willpower. It is not a moral failure. It is not just bad choices. Choice may be involved early on, but over time, repeated substance use can change the brain, body, behavior, and decision-making system. A helpful phrase for patients is, substance use disorder is not your fault, but recovery is your responsibility, and you do not have to do it alone. Part 2. Substance use versus substance use disorder. Not everyone who uses a substance has a substance use disorder. A person may drink alcohol occasionally and not have problems, but it becomes a disorder when it causes repeated problems and a struggle to control it. Signs include using more than intended, trying to cut down but not being able to, and spending a lot of time getting or using the substance. Also cravings, missing work, school, or family, and continuing use despite relationships being affected. Other signs include tolerance, needing more for the same effect, and feeling sick when stopping, which is called withdrawal. The question is not only, how much does the person use? The question is, what is the substance doing to their life, health, safety, and control? Part 3. Common symptoms and warning signs. Substance use disorder can show up in many ways. Physical signs include changes in sleep, changes in appetite, weight loss or gain, and poor hygiene. You might also notice red eyes, slurred speech, shaking, sweating, nausea, or track marks. Emotional signs include irritability, anxiety, depression, mood swings, anger, shame, and guilt. Behavioral signs include lying about use, hiding substances, borrowing or stealing money, and missing appointments. Other signs include legal problems, driving under the influence, changing friend groups, and isolating. Remember, substance use disorder often travels with depression, anxiety, PTSD, bipolar disorder, and trauma. Part 4. Neurological root causes. What happens in the brain? Substances can hijack systems that help us survive. The brain has a reward system that helps us repeat things needed for survival, like eating, drinking water, bonding with others, and feeling connected. Substances cause a strong release of dopamine, a chemical involved in reward, motivation, and learning. Dopamine tells the brain, pay attention. This matters. Do it again. The brain then connects the substance with survival. The brain is a learning machine. It learns cues like stress means alcohol or pain means pills. These reminders are called triggers. Triggers include people, places, emotions, payday, parties, boredom, and even certain smells or memories. Tolerance means the body gets used to the substance. The brain turns down its volume because the substance keeps blasting the speaker. Withdrawal happens when the substance is stopped. It can feel terrible, with symptoms like sweating, shaking, and severe anxiety. Important. Alcohol and benzodiazepine withdrawal can be life-threatening and may require medical detox. Substance use disorder affects the brain's stress system. At first, the substance may feel like it reduces stress, but over time, the brain becomes more stressed without the substance. This creates a painful cycle. The prefrontal cortex acts as the brain's brakes. In SUD, the reward system yells, "Use now," while the brakes have trouble slowing things down. Substance use disorder can run in families. Genes can affect how the brain responds, but genes are not destiny. Environment, trauma, support, treatment, and coping skills also matter. Part 5. Psychological root causes. These are the thoughts and emotions that contribute to substance use disorder. Many people use substances to cope with anxiety, trauma, or pain. They might say, "I use so I can stop thinking." Trauma is a major contributor, including abuse, neglect, violence, medical trauma, or discrimination. Substance use disorder often creates shame. Shame can actually fuel more use because the person uses to escape the pain of shame. Shame keeps people sick. Accountability plus compassion helps people heal. Cravings can feel like a wave. They rise, peak, and fall. Treatment teaches that a craving is powerful, but it's not a command. Part 6. Social root causes. Substance use disorder is also shaped by a person's environment. Social causes include family stress, peer pressure, poverty, access to substances, and the barrier of stigma. Stigma is a huge barrier. NIDA emphasizes that addiction is a complex disease, not a failure of morals. Part 7. Medical and safety considerations. Substance use disorder can affect the whole body. Medical concerns include liver disease, heart problems, infections, poor nutrition, and risk of overdose. For PMHNPs, always assess withdrawal history, overdose risk, suicide risk, and access to naloxone. Part 8. Treatment options for substance use disorder. The good news is that substance use disorder is treatable. Treatment includes motivational interviewing to explore reasons for change, and CBT to build coping skills. For opioid use disorder, medications like buprenorphine and methadone can save lives and reduce cravings. For alcohol use, naltrexone and acamprosate are options. Nicotine replacement helps with tobacco use. Harm reduction, like naloxone access and fentanyl test strips, keeps people alive long enough to recover. Part 9. Nutrition, vitamins, and supplements. Recovery is brain work, and the brain needs fuel to heal. Supportive nutrition includes protein, fruits, vegetables, whole grains, and staying hydrated with water. Key nutrients include thiamine, which is critical for alcohol recovery, folate, B12, and vitamin D. Magnesium, zinc, iron, and omega-3 fatty acids also support brain and heart health during recovery. The key teaching point is, nutrition supports recovery, but it does not replace therapy, medications, withdrawal management, peer support, harm reduction, or medical care. To explain it to a patient, you can say, recovery means building a life where your brain has safer ways to handle pain and stress. Seek emergency help for slow breathing, gray skin, unresponsiveness, or severe withdrawal symptoms. Today, we covered the neurological, psychological, and social roots of SUD, along with treatment and nutrition options. The main message is this: substance use disorder is real. Substance use disorder is treatable. Recovery is possible with support, evidence-based care, safety planning, and compassion. People are not their addiction. People can heal, rebuild, and recover. Again, my name is Dr. Osevwe. For support, text 8329916 516 or visit rotationmatchnetwork.com. Thank you for watching.